we are on a mission to advance minimally invasive alternatives for women who are suffering from symptomatic fibroids. Our vision is for women to have options that they deserve in terms of addressing those uterine fibroids. Thank you for your partnership in advancing our mission.
Meet Acessa ProView. Acessa ProView is the latest generation of the Acessa procedure for fibroids, also known as laparoscopic radiofrequency ablation for uterine fibroids. The Acessa ProView is the first and only fully integrated system with radiofrequency ablation, laparoscopic ultrasound, and guidance mapping all in one. The procedure can treat nearly all shapes and sizes and locations of fibroids, including subserosal, intramural, transmural, and submucosal. The procedure treats heavy bleeding, pelvic pain, and bulk symptoms. The technology works by heating the fibroid from the inside out to destroy the fibroid tissue. It's a minimally invasive outpatient procedure with no cutting or suturing of the uterine tissue. The procedure can be summarized in 3 main steps. Step 1. Make 2 small incisions. Place 2 standard laparoscopic ports in the abdomen, a 5 mm port for the laparoscope and a 10 mm or 12 mm port for the ProView ultrasound transducer. Step 2. Identify fibroids. Using the fully integrated Acessa ProView laparoscopic ultrasound transducer, determine the location and size of the fibroids. Since the ultrasound transducer is placed directly on the uterus, it identifies fibroids that may otherwise go undetected. A 2018 study showed that the Acessa laparoscopic ultrasound identified 2 times more fibroids than MRI and transvaginal ultrasound. Step 3. Destroy fibroids. Under Acessa ProView ultrasound guidance, place the Acessa handpiece percutaneously through the skin in the peritoneal cavity. The handpiece is easily viewed laparoscopically and through the ultrasound. The tip is illuminated on the ProView screen. Using the purple target zone on the guidance screen, advance the handpiece into the fibroid by rotating it with gently downward pressure. Deploy the electrode needles into the fibroid by pressing down the slider on the handpiece handle. The electrode array should be at least 1 cm away from the distal edge of the fibroid. The electrodes are visible in the ProView ultrasound screen. The ablation zone will appear on the screen, visualizing the targeted treatment area of the ablation. Prior to the ablation, confirm the electrodes are deployed as intended and not near or through the serosa. Press the yellow foot pedal twice to start the ablation and deploy RF energy. The ablation will ramp to 95 degrees Celsius. The system automatically calibrates the time of the ablation using tested parameters. Press the yellow foot pedal to stop the ablation. After the ablation, retract the arrays completely and coagulate by pressing the blue foot pedal. Watch the coag on the laparoscope and pull back the device slowly until the tip is visible. Confirm hemostasis. No cutting or suturing is required. Repeat the steps until all appropriate fibroids have been treated. The most important predictor of completeness of the ablation is having reached the desired target temperature for the prescribed amount of time at set deployments of the electrodes of the handpiece. Patients go home the same day and are typically sent home on non-steroidal anti-inflammatory drugs, such as Tylenol. Patients typically return to work in 3 to 5 days. The procedure is billed under a Level 1 CPT Code. The all-in-one ProView system is designed to be easy to set up, easy to adjust settings, and easy to learn. Acessa ProView, the first and only fully integrated system with radiofrequency ablation, laparoscopic ultrasound, and guidance mapping. Acessa Health, on a mission to give women more options.